Okay, hello everyone. So now we will be continuing with the health unit. Okay, so unit one. So for in the morning, we have already seen regarding the factors affecting health. Okay, what is health dimension? So now we will move on with the health illness continuum. Okay, so I'll be start sharing my slides. Okay, is it visible? Is it visible, the slide? Okay. So now this we will learn about what is health illness continuum. Okay. I'll show you the diagram. So this actually what happened, if you see from the diagram itself, we have two continuum or two endpoint. We have death and we have high level of wellness. So in the middle one that is known as the normal health. Okay. So normal health it is in the middle. Then at the two end point of the pole, we have the death and high level of wellness. So if you can see in the right side, with more, if the person is having a very normal health, then if he keeps on improving his lifestyle, his habit, eating healthy diet, then he can achieve good health. Okay. Then after that, after with that good health, he can achieve a high level of wellness. Then in if you see in the left side again, we have illness. So illness is nothing but it is a deviation from any normal health. Like it can be because of any, it can be illness, it can be in many form. It can be because of physical illness, like when we have fever, when we have some symptoms like diarrhea, or it can be psychological illness, like it which can affect, or which will suppose if we have so much stress, depression, that is also one form of illness. So because of that illness, what will happen time by time, if we don't take proper care of ourselves, or if we don't go for checkup, or if we don't take care, then it might lead to, automatically it might lead to death. So if you see in this continuum, it says that clearly it shows that so our as an individual, as a human being, we are always in between these two continuum. It's not like once I'm healthy, I'll always be healthy the entire life. Not like that, right? I've already told you that our health is always dynamic. It does not keep on staying at the same point. So at one point of time, as an individual, me myself, in the morning I might feel healthy, but again in the evening I might feel sick, I might have fever, I might have so many other different symptoms. So as an individual, we are always in between these 2 points. At one point of time, we can have a very good health. Then suddenly we might deviate to illness, or sometime with that, if it continues, then it might even leads to death. So this health illness continuums, it means that as an individual, we are always in between these 2 point or continuum. So some point at one point of time we might be healthy, and in the other point of time we might be ill. Okay, so this is the health illness continuum, and the middle one, that means that is the normal health, which everyone, each individual should have. Okay, so if you see what does it measures, that health illness continuum, it also measures the person perceived level of wellness. So if you are well, if you are maintaining your health, if you are having a very good health, if you are well enough, then you might achieve a very high level of wellness. But if you are not, because of some problems or because of some situation, you might have some illness, so because of that illness you might have, it might leads to death. So these health and illness continuum, disease, are opposite end of a continuum. I have already shown you in the previous diagram also, we have two end, we have the high level of wellness and death. And individual health, it is not static, like if we have already discussed since before, our health it is always changing from one point of time to another. Okay, so it fluctuates and move back and forth within this continuum day by day. And the transition from optimal health to ill health is often very gradual. That means it happens very suddenly. You might not even realize, at one point of time you might feel very good, but suddenly after a few hours you might feel very sick. So this health illness continuum, it says that our individual health, it is always moving from back to forth within the continuum. And health is not a state to be attained one and for all, but ever to be renewed. So this, what does it state, that our health, it is not like once we attained a very good state of health, it's not mean like we will not do anything later. Like even though we are healthy now, but later on we might not know, we might feel sick again. So in order to renew that, what we need to do, we need to at least maintain whatever diet we are eating. We have to maintain that diet. We have to maintain exercise. We have to go for periodic health checkup. Okay, so that is the renewal. How you renew ourselves. Okay, so we need every time we need to renew ourselves, then only we will be able to keep ourselves healthy. Okay, so once we achieve a good health, it doesn't mean that it will be retaining for a lifetime. So we have to do some hard work in order to keep ourselves healthy. And from a high level of health, a person's condition can move through good health. Yes, I've already shown you in the diagram. So first we might have normal health, then good health, then it can automatically, it can move to poor health. If you're not maintaining your lifestyle, your diet, you might have poor health, then extremely poor health, then automatically the last point, that is death. Okay, so this continuum, it says that a person's life is always rotating in between those two endpoints. Okay, illness and health. At any point of time, any person's health status holds a place on certain point in between the two ends of the continuum. So you can be at any point. It's sometime you might be having a good health, sometime you might have a very good, extremely good health or high level of wellness, or at some point of time you might have a very illness or extremely poor health. Okay. Any point in the health illness continuum, it is a synthetically representation of the various aspects of the individual in the physical, psychological, and the sociological health. So, what does all those, if you see the health illness continuum, what does it indicate? It indicates our physical health, our psychological health, that means our mental, emotional, okay, or our emotions, whether we are having able to deal with our stress daily, whether we are able to cope up with anything with comes in our life. Okay, and also it represents our sociological state, that means how are we, in which, even how are we maintaining whether we are maintaining a good relationship with society, how is our social relationship. So that health illness continuum, it's mainly indicates these three important things: your physical status, your psychological status, and even the sociological status. So which is also, I think we have seen in the, even in the World Health Organization definition, they have clearly specified these in their definition: physical, mental, and social well-being. Okay, so this is about the health and illness continuum. I hope everyone is clear. Hello, hello.
Yes, ma'am.
Okay,
Yes,
so
Yes,
ma'am.
ma'am.
okay, so this is a very simple continuum. That means our health, it is always moving from back to forth. Okay, sometimes we might be healthy, sometimes we might feel sick. Okay, so this is the health illness continuum. So next we will be seeing what is the concept of disease causation. That means what causes disease in a human being. Okay, what can cause disease. So in order to understand this, I'll be using one model, okay, which is called the epidemiological triad. So I'll be seeing one by one. So before moving to that, let us see what do you mean by disease. So disease is just the opposite of health, okay. So disease, it can be either of physiological symptoms. That means physiologically, that means our body function, our organ or tissue, it is not functioning properly. Physiologically, when we say physiologically, it means function, okay. Or it can also be because of any psychological dysfunction. Psychological dysfunction means like if we have so much stress in our life, then it can affect our mental health. Yes or no? Because mental health is also very important aspects. And if you see, especially there is so many stigma related to mental health. So people, like there's a saying, like if you have any symptom, like if you have fever, it's very easy to go to the hospital and say that I'm having fever. But nobody will ever, if, even if they're having depression or even if they're having any mental illness symptom, they will not dare to go to the hospital because of the stigma. They will think that what people will think of us, what people will think of me if I go to the psychiatrist, if I go and visit a psychiatric doctor. So people will think that I am mad. So because of that situation, so many people, if you see, even especially among the youths, all are like, especially in India, depression is very common. Okay, because of the stigma, people are still very, they don't open up even if they have any mental problem. Okay, so disease, what does it means? It means it is a physiological or a psychological dysfunction. Okay, then illness means it is a subjective state. Subjective means saying, when we say something, suppose if one, if you are feeling, if you're not feeling good, then automatically you will say, right, I don't feel good today. So that wording which you say, that saying, that is called as a subjective. Okay, subjective and objective. Objective means a person's who is observing you, she will see that you look very pale, so that is a objective state. Subjective means what you are complaining, okay, that is called as subjective. So illness, it is a subjective state of the person who feels aware of not being well. So she should know that I know that if I am not feeling, if I have any illness, if I have fever or diarrhea, then automatically I feel very ill. Then I used to say, oh, I'm not feeling well, I'm not feeling good. So that subjective state, or that like saying, it is called as a illness. And sickness is what? Sickness is what happened when you have the when you have the illness. Suppose when you have fever, then automatically you will be feeling sick, and you will assume that sick role. Sick role means you will don't feel like doing anything. You will just lay down in your bed. You will have all the symptoms. You will start having, you feel like vomiting, then you don't want to eat anything. So that is a sickness role. Okay, so sickness is a state of social dysfunction. That is a role that the individual assumes when he is ill. So when a person is ill, or if he's having any illness, then automatically he will assume the sick role. Okay, so that means he will depend on others, he will not feel like eating. So all those, it is in the indicates the sickness. Okay, so these are the three definitions: disease, which is a physiological or psychological dysfunction; illness, which is a subjective state, that means what the person complains. The person who is ill, he will complain, that is called as a illness; and sickness, it is when the person, he will assume the sickness role. Okay, so next we will move on to the triad, which I've already mentioned. We'll be using this model. Okay, so if you see in this model, we have the three important factors: the agent, the host, and the environment. So these three factors, only when they interact, then only it will disease can happen, or a disease, they can start a disease, or they can cause a disease. Okay, so agent is from the word itself. So this is the most important factors which will cause the disease. So there are many classification of agent which you will be seeing later. So the main agent, that means this is the causative organism, or the causative factors which cause the disease. Host, from the word itself, host means it is that person to which the, suppose any microorganism, it will enter into our, into the host, and it will develop the disease in that host. So that is called as a host. Okay, and environments means it can be any environment. It can be biological environment, physical environment, the physical surrounding, biological environment, or it can also be your social environment. So these three important factors are there in this triad. So we have the agent which cause the disease, the host, it is the place where the agent will go and enter, and it will cause the disease in a host. Okay, so it, all those disease, it will be happening where it will happen to the host. Okay, then environment, it is environment only, which can be your physical environment, your physical surrounding, or it can be your biological environment, which can be your animals, insects, or any other living being, or it as then the third one, it can be your social environment. Okay, clear? Till now, everyone is clear? You have any doubt?
No, ma'am.
Okay, so this is very important. Okay, this triad. So you always have to remember this figure: agent, host, and environment. So we'll be seeing one by one. Okay, so what is an agent? Like I've said, it is the main important factors in the chain transmission of a disease. So without the agent, all those will not come. Okay, so it is the first important link in a disease chain transmission. Okay, so it is the one which will cause all the disease. So everything is started from where? From the agent. Okay, so the disease agent is defined as a substance. Okay, it is a substance which can be either living, or it can be non-living, or it can be either because of certain force, or it can be tangible or intangible. The excessive presence or relative lack, it can be because of excessive presence of that substance, or because of the lacking of that substance. Okay, it can also, which can initiate or perpetuate the disease process. A disease may have a single agent, or sometimes it can also, because it can, a disease can also be because of multiple agents which combine together in order to cause a disease. So in order to understand more clearly, okay, I have given a table classification of the agent. So this is a classification of the agent. Okay, so we have the biological agent. From the word itself, biological means these are the living beings. Okay, so what are the living agents of the disease? So these are like bacteria, virus, fungi, protozoa. So all these are the biological agents. Okay, so these will happen. I think nowadays, especially everyone is very aware about coronavirus, right? That is also a biological agent. So because of the coronavirus, what happened when it enters in our body? It caused so many disease in our individual. Okay, so that is also example of a agent. The second is the nutrient agent. From the word itself, nutrient means it is related to the diet. Okay, so these it can be because this nutrients agent, it can be because either you are taking less of the required amount, or because you are taking more of the required amount. Because taking less also is harmful, and taking more also is harmful. Okay, so we have to maintain a balance. So because of that, I think you must have heard of balanced diet. Have you heard of balanced diet? Yes or no?
Yes, ma'am.
Okay, so because of that, they used to say that whenever we eat anything, we should always maintain a well balanced diet. Okay, so what are the nutrient agents? It can be your proteins, fats, carbohydrates, vitamin, minerals, and water. So any excess or deficiency of the intake of the nutritive element may result in nutritional disorders. So some examples are I have given is the protein energy malnutrition. So this why it happens because the person is not taking adequate amount of proteins and carbohydrates. Okay, so because of that, the patient will become malnourished, or the person becomes malnourished. Anemia also, why it happened? Because of lack of hemoglobin. And this hemoglobin, from where we will get? We'll get it all from the green leafy vegetables. So all those, because of all those, the patient will have anemia. Then goiter. Goiter is also a thyroid disorder. Okay, where there is enlargement of the. Do you know about goiter? Have you heard of the word goiter? In which, if you see some people, they have a very their neck becomes very enlarged, right? Like,
Yes, ma'am.
yeah, this what it happened because of lack of iodine. Okay, so that's what, if you see in every advertisement also, they used to give na iodized salt. We always need to take iodized salt. Okay, then obesity, everyone know this is a very common problem, especially if you see in developing countries like USA. Okay, so these people, this obesity level is very high because what, they are taking everything in excess. And the one which I've given the example of protein energy malnutrition, that what, why it happened? Because the people are taking less amount. Okay, so this is the example of nutrients agent. So the next is a physical agent. So physical example is like heat. Okay, extreme heat also, what happened? We might have heat cramp. We can cause loss of sweating. Because of that, we might dehydrate. Yes, because of excessive cold, that also it can cause us, it can cause a disease. Humidity, radiation, sound. Okay, excessive sound also, what happen? If you are listening to excessive sound, then you might have hearing problems. Yes or no? So all these agent also, it comes under your physical agent. Then when we come next is the chemical agent. And the chemical agents means it is because of ingestions of any forms of chemicals. Okay, and chemical, it can be because endogenous or exogenous. Endo means these are those chemical which are produced within our own body. Okay, so this is called as the endogenous chemical. Then if you have exogenous chemical, means these are those chemicals which are produced outside of our body. So if you see the example of endogenous chemicals are like calcium carbonate. Okay, so this calcium carbonate, what happened if it accumulates for a very large amount in our body? It might leads to formation of the kidney stone. This is just an example I've given. Then urea also, it might cause uremia. What happened? What is uremia? Means it is the accumulation of this urea in our blood, which is very commonly seen in patient having kidney problem. Okay, then serum bilirubin, jaundice. I think everyone have heard of the word jaundice. This what happened because of the large amount of this serum bilirubin. If it is produced produced as excessively in our body, then it causes jaundice. And this jaundice is very common among the newborn or even among the adult. Okay, so these are the endogenous chemicals which can cause disease. Okay, then coming to the exogenous, for example, is like allergen. Okay, any allergen, it can be from anywhere. Then metals, because of fumes, because of dust, any type of gas. Okay, like carbon monoxide is gas is very harmful, right? Because of if you ingest Large amount of carbon monoxide, what happened? We might have breathing difficulty. Okay, we might also have confusion, all those. Okay, and another example is like insecticides and all these. So these are the exogenous agents. Okay, the next is mechanical agents. So these mechanical agent, it is very common in the place where the people used to go and work, like in an occupational setting. Okay, so because of not maintaining proper safety measures, okay, what happened? There might be some accidents. So those are very commonly occurred in the occupational settings. Okay, example of the mechanical agents, it can be because of friction, excessive friction, then accident, which can be because of not wearing all the safety measures or any other mechanical forces. So all those mechanical forces, it might cause a disease or some disability or dysfunction. Then the next is the absence or insufficiency or excess of a factor necessary to health. Okay, so this is also somehow similar. This one, like I've already said, anything which is absence or anything which is less, also it's very harmful to the body, because everything we need in adequate amount or in the required amount. Nothing should be more and nothing should be less. Okay, so example is in the chemical. If you see, is the hormones like insulin. So insulin, why does it? What does it cause? Because of the lack of, that insulin is very important for the digestions of the fats. Okay, so people who are having diabetes, what happened? Because of their body is not able to produce enough insulin, so they need to take extra insulin in order to maintain themselves. Okay, then the chromosomal factors like Down syndrome. Okay, sorry, some spelling mistake. It should be DOWN. Okay, I think you have heard of the word Down syndrome. Okay, then Turner syndrome. So all these also what happened because of the chromosomal abnormalities. Then lack of part or structures like any cardiac defect. Cardiac, it is related to the heart. Okay. So then the next we see is the social agents. So what are the social agents which can cause? This is mainly related to the social environment, like poverty. Because of poverty, also what happened? People, they would not be able to have a good lifestyle, they're not able to eat healthy, they don't have a proper healthy environment to live in. Okay, and it will affect their all aspects of their health. Okay, illiteracy, okay, smoking, abuse of drugs, okay, then alcohol, unhealthy lifestyle, social isolation. So all these also it in encompass the social agents. Okay, so are you clear with the agents? Okay, so the agents, mostly it is divided into your biological agents, which are the living agent. Then we have the nutrients agent, the physical agents, chemical, which can be endogenous or exogenous, mechanical agents. Then we have the anything which absence or excess, then the social agents. Okay, then next we will see what are the hosts. Okay, so according to this, like I've said, a host is a person in which the agents, he will enter inside the host and he will cause the disease inside the host. Okay, so the human host is referred as the soil, and the agent is like the seed. Okay, so a host, it offers subsistence and lodging for a pathogen and may or may not develop the disease. It does not always mean like just because an agent or any bacteria inside enters inside my body, I will develop a disease. It also depends on a person's immunity status. Okay, it also depends on his genetic makeup. It depends on his how much is the exposure, whether he is exposed for a very long period of time or whether it is only for a short period of time. Then what is the state of health at that point of time where the host and the agent enters, whether the person he is sick or he is healthy. If he is already sick, then it will make the person's immunity very poor, and because of that he might get the disease. And also it depends on the level of fitness. If he is very fit, healthy, then he might not develop the disease. Even if the agent might enter, still he might not get the disease because he is maintaining his fitness or he's maintaining his lifestyle. Okay, so the host factors, again, it is classified under the first one, it is called as the demographic. So demographic here, it includes what? The person's age, sex, ethnicity. Okay, like age. If example of age is like if you see people like common disease like diabetes, hypertension. These are very common once the people cross the 50 years of age or 40 years of age. So with increasing in age, there is also increased chance that a person will develop the disease. So once the host agent enters inside the host, who is a very old individual, he might develop the disease very easily compared to a young adult or to a children. Okay. Then sex, if you see of sex also, it is like some disease like lung cancer, it is very common among the male because they are smoking or they are taking alcohol, where it is not so common among the female. Whereas if you take an example of breast cancer, okay, breast cancer is also very common among the female. So depending on the sex also, it depends, it will affect our health. Okay. Then ethnicity also, certain race group of people also, some types of disease is very common among those people. Okay. Okay, so till now are you all clear? Yes.
Yes, ma'am.
Okay, so the next one is we see is a biological characteristics. Biologically, I have already said all those genetic makeups, the immunological status of the individual, the physiological function of the different organ systems, it falls under the biological characteristic. Okay. Then the socio and economic characteristic means this comes all your socio-economic status, which we have discussed, the education, the occupation, stress, housing. So all these also, it all will affect our health. Okay. Then the lifestyle characteristic means it comes all your lifestyle like smoking, use of alcohol, substance abuse, your personality traits, behavioral patterns. So all this, it comes under the host. So if we come to the environment, we have the extrinsic environment means these are those which is exposed outside of the host. Okay. So the environment, it is also mainly divided into the physical environment, which means it includes, it can be all the non-living things and the physical factors. What are those? Like those physical environment, it can be air, water, light, noise, radiation, climate change, geographical. All these also it can affect our health. Okay, so then the second is we have the biological environment. So biological environment includes the living things, and the physical environment, it includes mostly the non-living things and the physical factors. So these, it includes virus, all these microorganisms, insects, rodents, animals, plants. Okay, so all this, it encompasses our biological environment. And the last one we have is the psychosocial agents. Okay, psychosocial agents, this mostly related to all the culture, the values, the customs, all the habits that we have, the beliefs, attitudes, religion, lifestyle, health services, then even in the social and the political organizations. So all these political organization, if you remember, I have discussed previously also when discussing the factors. Okay. So in the, if you remember that under the environment, mostly we have the three environment, the physical environment, the biological environment, and the psychosocial agents. So only when these three interact, agent, host, environments, once they interact, then only the persons will develop the disease. Okay, so this is about the concept of disease causation, okay, in which we have three important aspects or factors: the agent, the host, and the environment. In which agent, it is a one which causes the disease. Host, it is a person in which the agent will enter and he will harvest there, or he will stay and he will cause the disease in that host. And environment, it is the environment. It can be physical environment, or it can be a biological environment, or it can be a psychosocial environment. Okay, so this is about the concept of disease causation. So please you remember this one. Okay, so you have to remember this triad. We used to call it as the epidemiological triad. Okay, so if you remember this one, then you can remember what is the disease causation. Okay, so any question? Okay, please ask if you have any questions. I have few minutes left. In the next class, we will study about the risk factors. Okay, everyone is clear?
Yes, ma'am.
Okay,
Yes, ma'am.
okay, I'll be sharing the slides later in the group. Fine. So you can go through. So if you have any doubt or any questions, you can ask me in the next class. Okay.
Okay, ma'am.
Yes,
Okay. Thank you,
ma'am.
everyone. Okay.
Okay,
Okay.
Thank you, ma'am.
thank
Yes.
you, ma'am.
You have question? Okay. Ask. Somebody is about to ask question. No? Yes. Yeah. It's not clear. Huh? Yes. I cannot. Otherwise, you can just type. If because your network is not, I cannot hear properly. Otherwise, you can even type and in the chat box. Okay. So you can give in the chat box also if you have any question. Okay, okay, fine. Okay. So, okay, thank you everyone. See you in the next class. Okay. Take care.